Tim Joyce, you know,
Hey, hey, hey.
we made another week, first of all, so congrats.
Yep,
Secondly,
yep. This is a big deal.
we're staying consistent. We're staying good.
Yep.
And I know this time, this is I think the first time that I'm the one that's running late, and you were like, "I'm here." You're the one that makes me nervous all the time. Like, is he gonna show up on time? I got like anxiety over it. But
Yeah, I
no,
like
you've
that.
been pretty much on time.
It's my it's my need to create attention, if I get attention as a result of walking in a minute late.
No, listen. And while we usually kind of do the recaps of our days and weeks or whatever, but
Yep.
I would suggest we both have pretty limited time today. We have an awesome, amazing entrepreneur on with us coming on. So Yosef and I, we crossed paths when I was living in Amsterdam. And Joseph
Awesome.
came to one of the Amsterdam Health 2.0 pitches, pitch your startup kind of thing. And there comes this Joseph, which I think the name of the company was different, but we were doing the same thing, but pivoted the names. But I will shut up now. Welcome to the shot, Joseph,
Hi,
Jim,
Eugene.
Joseph.
By the way, what Eugene was just saying was the first ever pitch I did, like in public, with you.
Oh,
Yeah.
really?
Wow.
Um,
I feel honored.
How'd
I
he
had
do?
no
How'd he
idea.
do?
I mean, we're still talking, and I invited him to the shot, so he must have done all right. But
Awesome.
well,
Nice to meet
welcome,
you, Jim.
and for our millions of listeners and viewers, take us through a little bit of your story, history, wherever you want to start. Obviously, we're gonna end with somewhere today, and then going forward, but it's up to you where you want to start, and we'll dive deeper into the questions.
Yeah. Maybe some background. So I lived half of my life between the Netherlands and the Lebanon, and half of
Okay.
my family are either engineers or doctors.
Okay.
And my father actually, when he was deciding what to study, he did a coin flip. His mother told him, do a coin flip and decide what you want to be. So on one hand, engineer, the other hand, doctor. So he did the flip and it turned out engineer. So he became an architect and a civil engineer, um, and really deep into engineering. And sometimes he feels like, his heart is still with medical.
Yep.
So when I
Okay.
was growing up, I loved math. Math and physics, and basketball. Those three things were really close to my heart.
Right.
And so I knew I wanted to do engineering, but I didn't know what kind of engineering. So my father, who had taught in a university called Delft, which is based in the Netherlands, said, "Look at their
Hmm.
website." So I went to the website, and the first thing I see is a Formula One car. And that was my fourth thing. I was at that time really interested in Formula One. So I said, let's study that. And that out to be aerospace engineering. And along that way, I specialized in sensors or mechatronic devices. So anything that measures signals, information in the aerospace, but also automotive space. Now, let me just kind of close the loop here. So my father one day was driving down the highway and suddenly felt his heart, racing. So he turned over the car, went straight to the emergency room, and nobody could figure out what was going on. So he spent the next couple months trying to figure out, ins and out, different procedures, and then I think only 6 months later they were able to diagnose it as one of a very common heart rhythm disorder that, if left untreated, could lead to stroke. And although I loved what I was doing in aerospace, I didn't like the application area, just metals and machines and improving that 0.5%
Hmm.
of fuel efficiency, although very important, but that's not where my passion lied. So I always, I think from the early days, maybe Eugene, we've also met in the quantified self world,
Yeah, that's right. That's
is
right.
like, how can we tie technology to people? And this came
Right.
out like, hey, wait, this is a problem to be solved. And basically the background we have, we're using the same software, our team, that we use for aerospace engineering. It's just like the MATLAB and the simulation software, and so the knowledge is the same, but the application area is different.
Have you implanted any of it in Eugene?
Eugene is perfectly healthy, so he doesn't need anything.
But I do have the implant, just not theirs, right? I have that damn chip in there.
Yeah. Can you still pay everywhere with your?
No, you remember that, right? I was trying to kind of use that instead of the Metro card in Amsterdam. So, and I think it worked for like a day, and then there's too many changes. But no, it's kind of useless, honestly, right now. But
yeah.
So maybe just. That's the beauty of the healthcare industry, that many of the entrepreneurs going into the space, there's always a personal story. And, outside of that, maybe your first public pitch, maybe also kind of dive a little deeper, like, just that entrepreneurial spirit, and especially in Netherlands, right? I mean, I think for some of the viewers, listeners, I've lived there for 5 years, love every single moment of it. It's highly kind of transactional country, but also, just get the deal done. Let's move things forward. Let's innovate. I don't know, stereotypically maybe, but generally speaking. So would love to hear your local experience through this journey.
Yes. So actually, to maybe yours, the Dutch are very non-transactional when it comes to partnerships and innovation. So one of our main reasons for being where we are today is because of the supportive ecosystem that the Dutch have towards innovation. So just a simple example, like setting up a clinical study. When you knock the door, you're not greeted with just a bill. This is what it would cost. As when you would go to maybe certain US hospitals, you say, I want to do a study with 10 patients. The first person that comes to talk to you is the person that writes out the invoice. And whereas in the Netherlands, I think there's a lot of innovation-focused mindset. It's not a country where you become, this huge company, but it's a country that gives you the freedom to operate, experiment, establish your fundamentals. And so one of the studies that came out recently is that 75% of VC-funded companies have no clinical studies. Because often it's a huge chunk of money to conduct long studies. So we've conducted 3-year studies, 2-year studies, 1,250 patient studies. But the way we accomplished it was through partnerships. So, and that really helped us forward. Even the municipality of Amsterdam, the Dutch Heart Association, the hospitals, they're very supportive. Now, maybe to add to Eugene, the pace of how things move in the US is probably 3 times faster. So we do have a lag, but maybe we're lucky because we're in healthcare where everything moves slow anyway. So if you were a tech-focused consumer product, you probably, you see Dutch companies really fast move to the US to be successful because of the capital needs, because of the speed to execution that's needed. Whereas in healthcare and medical, your clinical fundamentals, but also your adoption by the key opinion leaders and the cardiologists or the healthcare professionals that you're dealing with, they don't change their mind from one day to the day. Are you there for year to year, working closely with us together so the trust is gained so you can collaborate? I'll pause here.
Maybe just for me, because I know you guys know each other, but maybe just the name of the company and what the technology actually does. Because you've got awesome clinical trials and awesome relationships, but I'm a little bit I'm slow with the.
Slow.
No, it's good to bring him back. Bring him back, Jim.
Let's bring it back. So what we do is 30% of heart rhythm disorders are undetected. And the reason why they're undetected is because they can be what's something called asymptomatic. So they can be there for one moment. By the time you visit your physician, they're not there. And it's one of the leading causes of stroke. affecting, for example, in the US, we have 170,000 hospitalization, 120,000 deaths. And the challenge is having the device with you at the time that it occurs, which a lot of patients do not have. And we solve this problem using your smartphone. So we take an ordinary iPhone or Android phone, and by placing your finger on the camera for 90 seconds, we can detect atrial fibrillation, similar to an Apple Watch, but without the watch. And so we offer the 2 billion people that have a phone versus the 100 million that have a watch, a very accessible health equity solution to reach a lot of the undiagnosed patients.
And what's the name of the tech?
The tech is, we're called Happitech. The tech is called Heart Rhythm SDK. So that's the official medical name.
You must have seen it. You must have seen it, because while we never got to kind of full or any of that integration, actually Happitech is in our toolbox for the coaches. We just haven't gotten there yet fully, but part of that is to enable some of the heart health coaches, again, non-clinical aspects of it, to give some previous. But, you know, for all these millions of viewers and listeners, we just have not prioritized it.
And I can download this now from the store, or do I have to be part of like a clinical program?
Correct. So we're offering this at the moment B2B. So the hospitals provide it to the patient. And so we focused on becoming integrated into healthcare care flows, where if a patient has something, they can be helped, they can be treated. And so indeed, it's the physician, it's the nurses that provide or prescribe the solution to the patients.
But Yosef, remind me, and I could be completely going crazy because I was living in Amsterdam for 5 years. But you guys went more or less direct to consumer, and it was one of the most downloaded games or something in Netherlands, where you collected quite a lot of info, which I'm sure. So take us through that. Like, I remember this, you guys were all over the news.
Correct.
Yeah, okay.
Yeah. So we've created an SDK. So probably everybody's like, okay, so what? And one of the challenges is like, how do you show the power of the technology? And it's really hard as a standalone SDK API. It doesn't say something. It's the application that brings it to life. And so in our journey also, because we were mostly working in wellness, so not yet prevention, not yet regulated medical, which was ultimately our goal. We knew that a lot of partners in the wealth space, like Eugene, would benefit from our heart rate variability technology, but it was really difficult to promote that. And so what we did, we created this game that you control using your heart rate. So it's kind of like a mindfulness game, you know, that you put your finger on the camera, it detects your heart rate, and your goal is to become calm, or sometimes even get excited. And so that blew up completely. You know, we were like the top app in I don't know how many countries, and we even had Tim Cook speaking on it on a keynote. And it basically brought the attention that we wanted, and it created our first partnerships where our technology was used in a variety of situations, and also helped us to accelerate our medical impact. So we always wanted to have the impact on the patients, but the journey is just very long, as you will hear later, to get from point A to point B.
And where's the company at right now? Like, what's your stage? Have you raised lots of capital? Do you have the partnerships? Are you Netherlands, US?
So we've been very, let's say, capital efficient. So, and the reason why is we've been able to do a lot of these partnerships. So some of the other companies, like MedTech stages, to get to an CE TGA cleared, you needed to raise 10, 20 million to get to that phase. And so through really this ecosystem that we've created of partners, of, you know, working with, you know, very ambitious remote patient monitoring companies, we've been able to achieve a huge footprint. So, for example, we were chosen to be the national screening partner in the Netherlands, where we're going to screen 160,000 patients together with the Heart Association. again, it's because you're in the ecosystem. And so if you have a strong technology and you have the clinical evidence, you can go there. And so indeed, we are considered, Series A, in between Series A and seed.
Oh,
And
stop
our
defining
goal,
those these days, man.
yeah, I
Don't
know.
worry about defining this.
No, I know.
Right.
I know.
Yeah.
So, but
It's
I
so
think
funny how,
that's been a
the
strength.
venture capitalists,
Huh?
I was saying, Yosef, how the venture industry has put definitions versus the entrepreneurs defining ourselves, right? Like where we're at,
Yeah, exactly. This is why I started with our progress, because the money, some people can have like
Right.
50 money in the bank, but a deployment of 50 patients. And we
Might be
have,
huge.
huge deployments.
Yep.
But we believe now combining capital with what the fundament we have right now will really help to scale. So that mindset is also a bit of a Dutch mindset where, you build, you sell, you work. Whereas the US mindset is from day one, just give me a big bag of money. I'm just going to conquer the market. Even if I didn't prove anything, I just have a great story.
Right.
I just name drop a few people and then boom, I get the money. So there is a balance there.
Yeah. Well, you got some names
I probably
to
didn't
drop
use them
there,
enough,
like Tim Cook.
I was gonna say
You
you
got
need to
Eugene.
bring that back in your fundraising mode. You know what?
Yes.
We're gonna tag. Is Tim Cook even on LinkedIn? I don't even know. But you know what? Fun mention of the day is gonna be Tim Cook and Apple. There you go.
Oh, okay.
Yeah, exactly.
So you mentioned, and that's kind of when I was living there for 5 years. It was definitely this fertile testing ground, right? I mean, it's, if I'm not mistaken, 16 million-ish population overall, and then all the great entrepreneurs would have their eyes on, let's call it the rest of the continental Europe, broader. But even there, the preference was like, well, let's just hop over to US, right? Because for so many reasons. Is it still that way now? I mean, I haven't lived there in 6 years now, something like that.
So just repeat the question one more time as I was putting the iPods. I
Oh,
think
the
you said something
headphones.
like going from the
Oh,
Netherlands to the.
so I was saying very briefly, the Dutch entrepreneurs, great testing ground, but then let's go and 300
Absolutely.
million contiguous market. Is it the same still 6-7 years
Absolutely. It's
later?
still the
Yeah.
same. And even now, it's become even US first because we're changing our medical regulations again. Well, not again, but we're changing our medical regulations. We're changing a lot of our privacy, a lot of the security guidelines, making it just more and more difficult to conduct studies, to do research, to do and then it becomes like it's not worth all the time investment. You might as well go straight to the biggest market. And the FDA they really know, for example, AI. They have a lot of engineers. You have the conversation where you understand each other, I think, faster. So they're very critical again, but what you're up against, like what kind of study you need to do to move forward. So that's very helpful.
I was just gonna look up who I know from the Ministry of Health because we need to tag some of the people to hear from the entrepreneurs. But I think everywhere is somewhat convoluted. I agree with you, right? I forget the numbers, but this many X number of technologies have been approved by FDA. But there has been always this like sharing of, from the trade perspective, from, best practices. Like I remember Herko and team, right? Many others. And actually, one other fact that I still remember, that parts of Obamacare, the whole Obama delegation came to Netherlands, and while maybe not fully modeled after Netherlands, but a number of key components of the Obamacare at the time was actually taken from the Dutch system.
Netherlands.
And
So
maybe
Joseph was
that
like,
is
yeah,
also
so
when you have a good working healthcare system, right? And most people never have to open their wallet to buy anything, to pay for any kind of healthcare service, unless you're getting some plastic surgery or dental work done. And of course, you have your own risk if you have to pay off a certain amount, but you don't open your wallet really. And so, And so people are not used to paying for care, so they will use what you have. You could pay $10 for an app, for example, or you can just go to your hospital and the insurance gets charged a few $100, but the patient doesn't have to pay anything. So your $10 app, if it's not reimbursed or if the patient doesn't get access to it for free, there needs to be some kind of need. But going through healthcare in the Netherlands is allows you to be part of the system that people are used to. So that's also the downside of having a good healthcare system. You don't leapfrog, like developing countries, like you see Brazil, like mobile payments being adopted 20 times faster than so you need to have something kind of a bit broken in order to
have
for
a
innovation
need,
to be
like the need. Yeah, I always find, like, we launched with my company, with Health Beacon, the Netherlands was one of the first markets we launched in successfully, but the barrier, the bar, and then as a result of kind of having a functioning system, you had to, you just had to go through the process in a different kind of way. I think they were open to innovation. That's the feeling we got, but it took a while. It took a while, and there were more rules. Other healthcare systems, like you said, you could leapfrog it, and people were just looking for any kind of support they could get their hands on.
Yeah. So innovating that part, fit the messy part, like, let's do studies here, let's figure this out, let's try this out. This is great. Really, the mindset here is, collaborative, explorative, and it doesn't go straight to commercials. And so you have room as a startup to navigate the ecosystem much more than maybe the US.
I know, there's just so many ways we can go, but I know we're both kind of in a rush here, Jim, and I appreciate, Yosef, you jumping on, but while would love to go deeper, I think we're going to jump to Jim's, famous question of the day, and we'll wrap up.
And I have eager board members waiting for me coming outside of this thing. Phenomenal
it's already
people, for the record.
Magical that you were doing it before.
I was shocked.
Yeah, this is my therapy. Eugene's a therapist for all of us here, So you are you're walking through the canals of Amsterdam, and you look over, and next to the cafe is this exciting. There's a group of entrepreneurs that have just come out of a Health 2.0 pitch, and one guy sitting there, and he's flipping a coin. And you see him, and you walk up to him, and you say, "What are you flipping a coin for?" And he says, "Well, deciding whether I want to be an entrepreneur or a professional basketball player." And he says, and you look at him, and you say, "Well, what's your background?" Well, I worked in aerospace engineering, and my family, I come from doctors and engineers, and actually moved from Lebanon. And you look at him, and it just reminds you of a younger version of yourself. And he looks up and he says, "Yosef, I've heard of you. When I start my company, what's the one piece of advice you would give me as I start in this venture to build my own health tech company?"
That's a great question, because like 20 things come to mind, obviously. And I think let's call it medtech company, because you have a long time to market, which is going to be 5-6 years. And so the design of your clinical studies and the regulatory pathway, if you design them in a smart way, you can cut half the time. And it's always a challenge because you are working with the clinicians, so they want perfect. And there's a balance between perfect and good. And so by choosing a perfect clinical study, you are now, 3-4 years in the clinical study mode, which is good because it sets us apart that it took that long time and it's a big study. But then if you look at it from an entrepreneur perspective, is there a way that you can design a study in such a way that the patient flow is faster, that the inclusion goes faster, having kind of like an 80-20 rule idea, because that allows you to move and then maybe do more studies. And to that, if you also bring, a big bag of money, you can get double that effect. So
awesome.
So finding money and the balance between perfect and good. That's the one sentence. I love
The
it.
clinical study,
And
because that
yeah,
defines your medical device. If you want to do it right, you need the clinical study. But the design of that
Awesome.
study can become so complicated. Yeah.
Yep.
Good luck on your board meeting.
well,
Thanks.
Yosef, thanks for making the
Yeah.
time. Over and out.
Take care.
See you guys next week.
Bye.
Hit subscribe and
Yeah.
pass it on.